Hi, I'm Dr. Tony Mork, orthopedic surgeon, endoscopic spine specialist. In this episode, I'd like to talk a little bit about annular tears of the lumbar spine. Annular tears are kind of a popular topic, very confusing to most people, and it's really become an interesting topic for me over the past 15 years and has really taken quite a while to kind of get a hold of. Even to the point of saying that I actually don't think that the problem are annular tears exactly as the sole cause of this particular problem. There's also some questions about the treatment of annular tears, which is what I want to talk about a little bit today. And there's particularly questions with, whether you should use the laser for treatment or you should use maybe to seal the disc and all. And I can just tell you a little bit about what I've discovered over the past years. First of all is understanding the concept of an annular tear. And actually, what is it? An annular tear. And I have really quite a few YouTubes dedicated to this with pictures, which is not really possible with the podcast. So I urge you to take a look. Just put Dr. Tony Mork and annular tears in YouTube, and you can get some pictures to go along with this. But I think that the confusing thing is probably 90% of annular tears don't hurt. So if you look at the literature and you look at uh, things on the MRI scan, most annular tears don't hurt. So why is it that some hurt and others don't, and the majority don't hurt? That question I don't have a good answer for. But I can tell you a little bit more about the ones that hurt. And I will say that, the couple problems. One, the diagnosis of these chronic low back pain is, I think, very difficult because sometimes annular tears can be seen not with an MRI, which I don't think is a great way to evaluate chronic low back pain, but a discogram. And the problem with discography in this day and age is that some papers were written several years ago that demonstrated that there was an increase, incidence of the possibility of a disc herniation if you did discography. So discography was associated with the possibility of having a disc herniation. I mean, it wasn't very much, maybe 9 or 10%, but it was enough to get people's attention, and so making the suggestion that discography may not be the greatest thing to evaluate low back pain. But the fact is, I don't know how else you can really do it. There's no other good way to evaluate the inside of a disc other than putting a small needle in and putting some contrast in. And the paper, at least as I understood it, had fairly young people involved in the paper, whereas most of my people are older, certainly 40s, 50s, 60s, and they have a bad disc. So I never have seen this phenomenon where they get disc herniations after discography, but that's just something to just note why it's maybe not so popular. In any event, so the MRI is not a good way to evaluate it. And people with chronic low back pain, they go to the maybe orthopedic surgeon or the spine surgeon, and they say, well, you've got back pain and I don't see anything on the MRI. And so go to physical therapy, which oftentimes aggravates the chronic low back pain, or go to pain management and you maybe get an epidural, but it maybe only lasts 4 to 5 days. So this constant cycle of treatment that doesn't really work, and the investigation process has been kind of stymied by the fact that discograms are sort of frowned upon in this day and age. But I think that if you do a discogram, you can oftentimes see annular tears, which has been the description by the radiologist when looking at these films. The problem is that it may not be just the tears. And so when I started to put an endoscope inside the disc many years ago, and particularly after encouragement by Dr. Tony Young to put a acidophilic dye, so you can use something like methylene blue or indigo carmine, it stains the interior of the disc. And what does it stain if it's acidophilic? Well, dead tissue, basically. So as I began to do this, I would see dead tissue floating around inside these discs. Now the discs are really, there's not much going on inside. There's very little circulation. Circulation kind of comes through the end plates. There's no real blood vessels inside. And so the environment is really acidic and also low in oxygen content when these fragments are floating around and disintegrating inside the disc. So, geez, I thought, well, you've got these fragments floating around. It's essentially dead tissue. And I had sent, of course, these tissue fragments to pathologists, and they concurred that it was non-viable tissue breaking down inside the disc. So also these fragments, where did they come from? Probably the disc. So some of the disc broke off from the nutritional supply or the end plate and started floating around and started to break down. And then under the weight of the body, these tissue fragments, free-floating fragments, began to burrow their way to the periphery of the disc and then out to the annulus. There's no real nerves inside the disc for pain, but the annulus has got a very rich nerve supply where the fragments, if they get in contact with this area, either mechanically or maybe chemically breaking down, could generate significant pain from the annulus. So the fragments, in my opinion, under the body weight of the pressure and body weight, migrating out to the periphery are causing, or certainly a major contributor to the annular tearing process. I don't think the annular tearing process just occurs maybe spontaneously, but I think that this fragmentation, then moving out into the periphery near the pain nerves of the annulus, can be a real source of back pain. And as I began to put the scope in, after staining the disc and seeing the fragments start to kind of come out of the disc, it made a lot more sense. And people will feel in significant improvement oftentimes when you endoscopically remove these fragments from the disc. It explains the whole phenomenon. People say, well, my back gives way. Well, it's not really giving way. It's one of these fragments moving in and out of the wrong position inside. And when you start to remove these fragments, people almost always will have that particular complaint removed. So they won't say that my back gives way. They may have a sore back on occasion, but they won't say it's giving way once you remove those fragments. So one of the tools, at least I tried using, was the laser inside the disc. The reason I didn't really like the laser was because it's got so much energy that when you applied it to the tissue inside the disc, it generated just a cloud of more material. And this material, again, not living, and actually there's some articles that say it may not be immunogenically privileged. So it means that if this stuff gets out of the disc space itself, it can actually maybe set up some type of a tissue immune response, which is potentially problematic as well. So I stopped using the laser because I thought it had too much energy and just created too much debris, whereas use something much lower energy, where you melt the tissue a little bit that's waterlogged, and you can start to grasp it with a grasper and pull out what you can pull out. The other thing, in addition, you hear a lot of things about sealing the disc. And I think that the problem with sealing the disc, which is something that I've been working on recently, is that if you seal the disc before removing the fragments, you may have sealed the problem in place. So if you seal the disc, because they leak, you can see this on the discography, where putting some contrast in, you'll see it kind of leaking out the back. And I think this is one of the ways that you can actually have chemical stimulation of the nerves inside the spinal canal, where the actual chemicals can leak out against the nerves. I don't think the nerves can always recognize the difference between mechanical pressure and chemical stimulation. So this is how you can get leg pain or radicular pain without really without a disc herniation per se. The nerves are getting chemically stimulated. So I think that the whole idea of sealing the disc is potentially a great idea, but I think that the fragmentation inside the disc has to be removed before sealing it. And there's a couple different ways to do that. I think there's different sealing, which, like I said, I'm kind of working with now to see what can be done to inject the disc But it would have to be done probably after the surgery was done to clean up the disc. You could seal it afterward, but the hole that the endoscope has it needs to just seal over itself and heal so that the disc remains kind of contained. And when you put the sealing in it, it should not be leaking out of the surgery hole for the endoscope. So it has to be probably done a little bit later. Also, chemically, you could sometimes do it. There's some prolotherapy injections for the disc that demonstrate good pain relief as well. And these are done by causing a little inflammatory response, which also you can imagine could seal the disc up as well. And I've seen that work as well, and without even doing the surgery. But if you do the surgery, again, I think you're removing the fragmentation, which I think is kind of just the most basic of surgical principles. If you want a wound or anything to kind of heal, you want to remove the dead tissue in the area that might be interfering with the healing process. And I think that as these little fragments are interposed in the annulus, that they cause permanent problems for back pain unless you make an attempt to remove these. So that's something that I think is worthwhile to remove the fragments endoscopically, which I think are responsible in large part for the tearing of the disc, which is what they're called, annular tears. But on the discography, the MRIs, or any other tests I'm aware of, you cannot see these fragments. You have to put an endoscope in, and best to stain the tissues to actually see them. That's a little bit my idea about sealing the disc, is you really need to do an endoscopic washout before sealing it. I think it would be more effective. And again, I'm working on this particular project now to both to see how well this actually works and compare it against the patients that I've done who just have the fragments removed and maybe don't need to have sealing done, as the sealing process is done if people are having persistent pain and problems after the removal of the fragments. And again, the removal of fragments is improving the healing environment inside these discs, which are acidic and with existing with low oxygen content, so poor healing potential because of the poor blood supply. So cleaning up the environment inside the disc by removing the disc fragments, actually has the chance to, I think, improve the environment inside the disc for healing. Thank you very much for listening to this podcast on annular tears. The topic is one of chronic low back pain and what can be done endoscopically to treat this problem, which is a huge problem. And any way to avoid a fusion, I think, is a great endeavor. And I look forward to hearing from any questions you have. I invite you to subscribe to this podcast channel. And hopefully we'll see you again, and we can talk about another interesting topic on the back rant, about other problems that might be solved with endoscopic spine surgery.